The topic of exercise as medicine. How can strength training solve our chronic disease problem?
My perspective on the chronic disease burden and the role that exercise can play is that we really need to start to think about the science and the adherence to exercise. I've said to a couple of your previous guests, James Steele and James Fisher, we shouldn't need any more research in this area of what is the best intervention. We need more research in this area around how do we get people to adhere to it. 56% of Australians have got a chronic disease. About 25% of Australians have got two chronic diseases. If you start to cut that down by age cohorts, it just gets higher. All of the evidence in our world is that exercise is the best thing for back pain. Exercise is the best thing for diabetes. Exercise is the best thing for cardiovascular disease. If you have worked in exercise long enough, so if you've owned a high intensity training business and you've done X number of sessions per week and you've done it over a couple of years, the evidence is strong enough that I don't know what the number of sessions is or the number of years you need to have worked, but you have saved somebody's life. Like, you haven't made them a little bit stronger. I'm adamant that strength gains are the least important part of strength training. If you do this long enough, you will save someone's life. And I honestly believe that not only do most patients or clients, depending what you want to call them, underestimate the benefits of exercise, I think most people underestimate the benefits of exercise. And when people say to me, "Oh, I can't lift weights because I've got a sore back," I want to pull my hair out, because the best thing that you can do if you have most of these chronic diseases that are causing problems in Australia, US, and the UK, so cardiovascular disease, dementia, type 2 diabetes, back pain, one of the best things that you can control as an intervention is go and do exercise.
Lauren's still here, and welcome back to High Intensity Business, your one-stop shop for growing your strength training business and fueling your passion for high-intensity strength training. I am very excited about today's guest and today's episode. And today we have Tim Dettmann. First and foremost, Tim Dettmann is a physiotherapist, but not the kind of physiotherapist who does massage and applies heat packs. The type of physiotherapist who spent 15 years doing rehab and preventative strength training using Medex machines and Arthur Jones's training principles at Kieser, Australia. Tim and his partners took Kieser to 26 clinics, 600 team members, and 20,000 training members before he sold out the business in 2024. Congratulations, Tim. Today, Tim is a speaker and coach for clients right around the world on the topics of exercise as medicine, sustainable high performance, and scaling your business. As a clinician, executive, and academic, he brings a unique perspective and is very comfortable to challenge the status quo. We'd love to see that. And move the needle on who and how many people are participating in exercise. Tim's approach is equal parts evidence and empathy, because systems don't change unless people do. I love that so much. Tim is founding director of Kieser Australia, largest physiotherapy company in Australia, university researcher and lecturer at RMIT and University of Melbourne, and physiotherapist for Australian morning TV, The Today Show. Tim, thank you so much for being on the show. I am so excited to talk to you.
Lawrence, thank you so much for a very kind intro. Hopefully we can move the needle on people participating in exercise today, but It's been a long time since you and I caught up for a podcast episode. So I agree. I'm looking forward to this evening for me in Australia as well.
Yeah, thank you. And yeah, thank you for making the time. And yes, no, it's been too long coming. And today, guys, we're going to focus on the topic of exercise as medicine. How can strength training solve our chronic disease problem? Obviously, many of my listeners will be very familiar with this. This is their drive, their passion behind their business. How do we get more people doing this? How do we prevent these bad things from happening to people rather than focusing on the treatment side of things? And I thought we'd just kind of start off with like a setting the scene. Like, can you give your perspective on kind of the rising chronic disease burden that you see in Australia and the wider world?
Yeah, Lawrence, thanks for bringing this subject to podcasts. And I think also thank you for the perspective that you bring that is both science focused and also commercially oriented as well. I mean, my perspective on the chronic disease burden and the role that exercise can play is that we really need to start to think about the science and the adherence to exercise. I've said to a couple of your previous guests, James Steele and James Fisher, we shouldn't need any more research in this area of what is the best intervention. We need more research in this area around how do we get people to adhere to it? Because the numbers are, these numbers are Australian, they apply to the US and the UK equally. 56% of Australians have got a chronic disease. About 25% of Australians have got 2 chronic diseases. If you start to cut that down by age cohorts, it just gets higher. So if you own any type of physical activity facility in the world, anywhere in the world, if you have a new client walk in tomorrow, it's more likely that they will have a chronic disease than they won't. So this is not a choice or an option for people. If you want to run your business and you want it to still be running in 5 years' time, you need to engage with the idea of exercise is medicine in some way. Some businesses will engage a lot, other businesses will engage less so, that's fine, but you have to engage. It's not a choice unless you're in elite sport, which is about 5% of the world. That's it.
Right. And that's obviously where your kind of career started and you realized, actually, I'd like to impact more people.
Well, so as a 16-year-old, I thought, growing up in country Victoria, I thought, I want to be an elite sport physio. I want to go and work in Australian rules football. How good will this be? And I realized within the first 6 months of starting my physio degree, I realized if I'm not a physio to those elite sports people, someone else will be, and they'll do a wonderful job, probably a better job than me. But I also realized that as a physio, we were being taught exercise-based medicine, and that meant we were getting a lot of learning about exercise. And so all of the evidence in our world is that exercise is the best thing for back pain. Exercise is the best thing for diabetes. Exercise is the best thing for cardiovascular disease. But I looked at our industry, and our industry in Australia was still very passive in its interventions. And I'm sure that the UK and the US is somewhat similar. So, my motivation for joining Kieser and growing Kieser was that I genuinely believe that is the future of both the fitness industry and of the allied health industry as well, is encouraging more people into exercise.
Yeah. And as you know, one of the reasons I wanted to revisit this topic of talking about, how strength training can help solve the chronic disease problem is starting and operating a strength training business is hard. All business is hard, but it's particularly difficult, as you would know better than anyone, in terms of dealing with trying to educate clients, trying to, overcome objections, pulling your hair out, or not in my case, when clients cancel and you're like, but you have to do this. Strength training should be like brushing your teeth. We had a really awesome mastermind a few months back in High Intensity Business Pro, and Doug McGuff surprised us and joined the call. And he was explaining how important it is as a business owner to just stare at yourself in the mirror like every morning, and and not to be too woo and talk about manifestation here, but to say affirmation in the mirror to remind yourself how important what you do is for people, and because you almost need to constantly remind yourself of that, because it's so difficult, because your customers will not perceive the importance as much as you do in most cases, right? So all that is to say that I just want to really help my audience understand better, or just remind them almost, because a lot of them understand and know this very well, just how important they are, right? And just how important this is, right? Yeah.
Well, I 100% agree. You've got me, you really get me up on my high horse here. I said this for the first time, I can't remember where I was. I said this phrase again now at the Discover Strength conference earlier this year, where I said, if you have worked in exercise long enough. So if you've owned a high intensity training business and you've done X number of sessions per week and you've done it over a couple of years, the evidence is strong enough that I don't know what the number of sessions is or the number of years you need to have worked, but you have saved somebody's life. Like, you haven't made them a little bit stronger. I'm adamant that strength gains are the least important part of strength training. If you do this long enough, you will save someone's life. And I honestly believe that not only do most patients or clients, depending what you want to call them, underestimate the benefits of exercise, I think most people underestimate the benefits of exercise. And there's an inherent bias in this. There's a reason for it, is that you and I strength train twice a week. And we have done for most of our lives, and we will do for the rest of our lives. So we don't experience being unhealthy like what most people do. We don't have that experience of going to pick up the bag of shopping and it being genuinely heavy. We haven't experienced how psychologically unsafe, weak, threatened that you can feel when your body doesn't support you. So we, as a result, we underestimate just how beneficial strength training can be. Like, anyone who says, oh, strength training is a little bit, is good for your mental health, like, that's great, but it is completely underselling it. Like, people who participate in strength training have a 17% lower risk of cardiovascular disease. Like, not a 1% lower risk, or not a 3 or a 5 or a 7. It's a 17% lower risk. The evidence around physical activity and exercise, the things like lowering your risk of dementia and Alzheimer's. Again, we're not talking single digits. We're talking double digits, north of 20%, lowering the risk. And it's one of the only things that we can control. So I have, I've looked into the eyes of so many trainers, exercise scientists, business owners, and said, like, what you do is going to have a really big impact on the individuals that come in to see you. And yeah, I honestly think we underestimate it, all of us.
Yeah, I love this topic. So much you said there, I wanna expand on. You said there about, most people, not just our clients, but all people, us included, underestimate the benefits of HIIT or strength training, because we've not experienced, or most of us have not experienced really bad health as a result of not being fit and strong. That's so true, because I've personally only had like acute bouts of things here and there. Like a few months ago, I had some lower back pain, and I wasn't really training my lower back that consistently, and I was sitting a lot, right? And it was like, oh, this is actually kind of nasty. Like, every time I'm going down to pick something up off the floor or whatever, this is a problem. And I was doing like prone trunk extensions, but I just didn't feel like I was getting enough recruitment and results from that. So, and there is a obviously Optimus Strength, who I hope to co-found here in Galway. They have a location with a beautiful MedX lumbar extension machine, courtesy of Egert Barvik. But it's over the other side of town, so it's just very difficult to get to because traffic is notoriously bad. I won't bore you with the details. So in lieu of that, I decided to do the 45-degree Roman chair approach and progressive weight, which has been a game changer. And now I have 0 symptoms and I'm feeling great. But it's those little, I think most people can relate to that, where you get a little glimpse into what it looks like to have a deficit of strength or have a problem and pain. But then obviously, as soon as you recover, and we spoke about this a little bit at Rec all those years ago, as soon as you then recover, you kind of forget. Whereas it's so hard to put yourself in the shoes of someone who does have chronic pain. So having that empathy is difficult. Yeah.
Yeah, Lawrence, you're 100% right. And this is where the science and the commerciality of business needs to cross over. It's really important as an owner. One of the first things you've got to acknowledge is that it's very, very, very unlikely that you represent your clients. Like, you're not a good match for your clients. So how you think about exercise and your approach to exercise is probably not the same as what theirs is. So I'll use an example, and I know we're not specifically talking about just injuries today, but when you had your back pain, how scared were you that one of your discs was going to slip out the back of your spine and you would be, left in unbearable pain and unable to walk? And
Yeah,
how
I
scared were you?
was quite fearful. Yeah.
And how scared were you the first time that you did some exercise? Did you know that exercise was probably going to help, or were you scared stiff that if you did any movement at all, that you were going to break yourself?
You mean when I started doing like the Roman chair and because I'd had all that experience?
Yeah.
No, I knew obviously that it was safe, and I just, I'm using a slow speed of movement. I'm progressing very gradually in terms of loads. So yeah, no, you're right. I'm coming from a totally different position. Yeah. So like, it's so hard for me to empathize. Yeah. Yeah.
So your empathy as a trainer, whether you be, an allied health professional or whether you be a trainer, dealing with people who have injuries, you really need to think about that empathy. I've literally seen thousands of people with back pain do strength training. And when people say to me, oh, I can't lift weights because I've got a sore back, I want to pull my hair out, because the best thing that you can do if you have most of these chronic diseases that are causing problems in Australia, US, and the UK, so cardiovascular disease, dementia, type 2 diabetes, back pain, one of the best things that you can control as an intervention is go and do exercise. But you know what? In Australia, you know what the number one reason people don't participate in exercise is north of the age of 45? Injury or illness. They just have a perception that they shouldn't be doing it. And
yeah, that must be the same across the West, I suspect.
I suspect it's the same across the world. And
maybe.
It's not enough just to know the science. Like, I can't, if you didn't have your experience, I can't just say to you, hey, Lawrence, don't worry about your back pain. We can get you on this exercise and it's going to be okay. Like, that's not enough. Like, we need to think. When I consult with businesses that do any type of strength training, I say to them, like, how do you address the physical safety of your clients, but also how do you address the psychological safety? And that's a phrase that came to me from David Schneider from Discover Strength. And I think it's a wonderful way to look at it around, okay, how are you making this person physically safe? And, the equipment, the MedX or the Kieser equipment is wonderful because it makes people physically safe. But how do you also address their psychological safety? Because, whatever chronic disease we're talking about, people with cardiovascular disease, they don't think that they need to go and lift weights, but it's exactly what they need to do. It's one of the best things to try and unload their heart, which is, chronically suffering. It's a great thing, but that's not what the way that they think at that time.
Yeah. Just want to back up slightly and kind of just remind people the benefits of strength training, how it can really help solve this chronic disease problem. I was watching a video this morning, actually, that the missus sent me on Instagram. And normally some of these exercise videos, I kind of cringe because they're like, about CrossFit or something. But there was a snippet at the end of this one, which was really, really strong reminder. It was some woman who's part of part of some kind of organization, Ireland. And she was just kind of reminding everyone or educating the audience on the importance of exercise. And she just listed off a bunch of stats. She said 40% decrease in all-cause mortality, 40% decrease in cancers. I know some of this is generalist because that's more nuanced. 45% decrease in cardiac arrests. And, obviously with an aging population, it's just extremely important that more people engage in strength training. And I was like, God, yeah, obviously I know these things, but we need to be reminded more than we need to be taught. Can you, I don't know whether you disagree with any of those data points, but can you, because I feel like you probably have a lot of that already, like that information retained. Can you give us like an overview of like all the ways in which, or the most effective ways in which you see strength training really helping solve this chronic disease problem, just to remind our colleagues the benefits that their protocol, their intervention can provide? Yeah.
Okay, so let me take a slightly different approach to this. knowing that most of the people listening to this will be business owners of some sort and practitioners that I'll be chatting to clients. Like, I think discussing it at a population level is really interesting. But what I've said to, like when I've presented to the Australian fitness industry or the US fitness industry, is I've said, we as practitioners need to increase our depth of understanding of how strength training or any physical activity helps certain chronic diseases. So how about I'll give you 1 or 2 lines on each of the major chronic diseases and how strength training helps. So back pain is one of the biggest burdens of disease anywhere in the world. And what we know in back pain is that there is some atrophy of 1 or more muscles in your lower back the longer you have lower back pain. That's not to say that weakness is the cause all the time, but it is to say that to get you back to being pain-free, we want to try and address these atrophy issues. So gradually progressing strength training is wonderful for people with lower back pain. Cardiovascular disease is a really interesting one because patients in particular think, well, I've got a heart problem. Why do I need to go and do strength training? And what happens there is when you do strength training, your muscles become more efficient at being able to produce energy and extract oxygen from your blood vessels as it circulates around your body, which is why if you participate in strength training for a couple of months with hypertension, then both your systolic and your diastolic blood pressure will come down a couple of points, average between 4 and 6 points, because it's decreasing the afterload on your heart. When we talk about osteoporosis, so osteoporosis is a loss of bone mineral density, more common in women, but associated with aging. And the best way, bone is a really active tissue. So the best way to stimulate bone to turn over is to load it. And you can either load it slowly, which is where strength training is wonderful, or you can load it really quickly by jumping. Obviously, the quicker you do it, the more risks are associated because you can overload quickly. So strength training is a great way to safely build your bone mineral density. And basically the rule is, unlike loss of fat, that you can have site-specific increases in bone mineral density when you're strength training. So if someone has a DEXA, which is the scan that people have when they have osteoporosis, and they have lumbar spine osteoporosis or lumbar spine osteopenia, which is a precursor, then you can give them very specific lower back exercises, start them lightly, progressively overload, be comfortable that if you've progressively overloaded them for long enough, they're fine to be working to 8 or 9 out of 10 in terms of intensity. That's safe. That you can site-specific increase their bone mineral density. I'll go one more because otherwise I can talk about this all night. But diabetes is a great one. So I do sometimes get frustrated with people who work in this space, and patients say to them, hey, how does strength training improve diabetes? And they say, oh, it burns glucose, which is, I suppose in some ways superficially is correct. And it's probably the beginning of the benefit to it. But type 2 diabetes, really big problem right throughout the Western world, probably for a whole number of reasons, is an insulin sensitivity problem. So you produce some insulin, but over time you become less sensitive to it. So what training your muscles is able to do is increase your insulin sensitivity. So your body doesn't need to produce as much insulin. And with strength training plus some other lifestyle modifications, depending which country you're in, they estimate somewhere between 30 and 40% of type 2 diabetes is reversible. Not treatable, but literally reversible. Like you can take someone with diabetes, give them strength training plus some other lifestyle modifications, and then down the track, they don't have it. Like it just ceases to exist.
Interesting.
And that's what I really want to highlight is strength training is so powerful because it can treat, prevent, and reverse some of these conditions. Now, is it a silver bullet? Does it do it for everyone? Is it the only thing that you do? Absolutely not. But it's definitely part of the picture. And if you had have spoken to the medical profession 10 years ago, so much advice would have been, oh, just go for a walk. Or, if you're good at walking, go for a ride. And that's not the case anymore. Like, we would, at Kieser Australia, we would receive in excess of 8,000 medical referrals a year. And that's public knowledge from medical professionals because of their increasing awareness of the benefits of strength training.
Amazing. So that
now I could keep going on about all these other chronic things, but I think as a bare minimum, if you are a practitioner working with people in this population, that's the bare minimum that you need to know about those diseases.
Yeah, obviously there's so much more. You touched on cognitive health. We haven't really spoke about like muscle mass and strength. And one thing I want to ask you is, it was my understanding, perhaps this is incorrect, that all type 2 diabetes was reversible. Is that not true?
Or you're probably getting beyond my scope of knowledge there. I know that some of it is, and that's widely agreed. My interpretation is that it probably gets a little bit controversial if you say 100% of it was reversible. Not everyone would have.
One of the things you mentioned earlier is you felt that strength gains were one of the least important parts of this. And I think I understand that in terms of like all those things you just listed are downstream effects of improving strength, or, or maybe it's, in some cases correlated. Why do you think that? Why do you think that strength is one of the least important outcomes, increase in strength?
Yeah, good question. Because I think my point there really is that people underestimate the other parts of it. There's a really good article, which Peter Attia references a couple of times. And so I have gone and read many times, and it's looking at the hazard ratios of being strong versus weak, fit versus unfit, being a smoker versus a non-smoker.
Super cool, that is. Yeah, cool.
The Mansangar article was published in 2018, I think. And basically what it says is that the positive benefit of exercise is more significant than the negative effect of smoking or type 2 diabetes when it comes to lifespan. And I really like that quote because it just people understand how bad smoking is for you, and they understand having diabetes, what impact that can have on your lifespan. But people just underestimate the impact that exercise, and I am now talking about both aerobic exercise and strength training, but both forms of exercise can have. And I also think, so getting back to my comment about strength and the benefit of strength, I encourage people to think about it like this, it's important to understand why strength is so important. So although the evidence says VO2 might be a slightly better predictor of longevity, if someone said to me, hey, Tim, I've got 1 hour a week free, the rest of my week is completely full, what should I do? I would say lift weights twice a week. And I don't even have to think about it, because if you can maintain your strength, then you can maintain your ability to be able to do lots of other things. So I had this client of mine who was diagnosed with multiple sclerosis. She was in her early 50s when she was diagnosed, and she didn't start strength training, but she went downhill over the first couple of years, came to see us about 5 years later, and she started strength training because her doctor had said that would be really good and it'll help you maintain your muscle mass. And I got along with her really well, lovely lady. And she came to me one day and she said, Tim, I went walking with my walking group. She has a walking group every Wednesday, right? She walks at 10 a.m. They go for a walk, have some coffee afterwards. She goes, I went for a walk with my walking group and I was talking and I was chatting along and we were walking up this hill and I was chatting and I was still chatting and I kept going. And I got to the top of the hill and I realized I was talking to myself because all the other girls were still halfway down the hill. And she said to me, does this strength training help with my walking? I said, I won't mention her. I said, what do you think about walking uphill? She said, yeah, it kind of makes sense that if I'm stronger in my quads and if I'm stronger in my glutes, that I can walk uphill a little bit quicker. And so, we then had a bit of a conversation about, well, this is the impact that strength training has. Because you're stronger, you can participate in more things. So you can go for a longer walk or you can walk faster. So therefore, the training benefits that you get out of walking are enhanced as well. So it's this positive feedback cycle. Someone whom, I would have had hundreds of patients who would come to me and say, hey, Tim, I can't play golf anymore. I want to get back and playing golf. And they think that it's really good for them to get back and play golf and be with their mates. And it's right. But that what we need to understand is if you get someone back to playing golf, or if you get someone going from golf once a week to twice a week, the flow-on effect of that is that they get 7,500 steps every one of those days because they play golf, which you've enabled through strength training. But the pillars of good health also involve social connection and purpose. So by allowing that person to get outside of their home, to go and join the walking group and not have to quit the walking group or rejoin golf, then they get that social connection afterwards, which, that's not what we're writing on the windows or writing on the advertisements when we're trying to build our strength training business. But it's actually the impacts that you're having on people's, longevity and health span.
Yeah. So it's like a catalyst for all those things. You hear it all the time, right? You have such a good sample size over your career, but you hear all the time someone starts strength training and they just spontaneously just become way more active because everything requires less effort. I love
I think
go ahead.
I think strength training is the great enabler.
Yeah.
I think strength training is the gateway.
Yeah.
And that's why if someone said to me, I presented to a travel company recently and they said, Tim, we're really busy. We're trying to grow this company. I've got 1 hour free. What do I do? I said, strength train twice a week, half an hour, done. Then, decision made. It is the best thing you can do, bang for buck, in my opinion.
Yeah. I love, do you know Dr. Doug McGuff's analogy about this where he says, and what you were saying there about the lady walking up the hill talking to herself? It's like he'll use the arbitrary value of like, if walking up a stairs takes 100 units and then of strength, and then after you strength train, it takes 75. It's that's how it manifests in terms of how much easier these day-to-day activities are. It just requires, it's less effort to do the same thing because you're so much stronger.
Yeah, I think that we all need to we all can get better at being able to tell these stories.
Right.
Because the story that is going to convince a patient to stay as a member, which you both want for their outcomes, and for yourself, from a business perspective. I honestly don't think there's many circumstances where you can say, oh, if you strength train for 6 weeks, you'll get a 30% increase in strength. Like, so what? Like,
Right.
you really need to attach it to something like Simon Sinek's why.
Yeah.
For every person who comes to your door, there's a reason why they've come to your door on that day. And they're probably going to tell you, I want to get stronger or I want to lose a little bit of weight. And it's your responsibility as a clinician to ask why 5 times in slightly different ways and find out what it actually is. Because they weren't, like, if they turn up on Monday, it's not like on Friday they were, normal weights. And then on Monday they were just, overweight. All of a sudden they're like, oh, I've got to do something. There is always a catalyst. And whether it's a health scare of their own, whether it's a health scare in a loved one, whether it's a health scare in a friend, there is always a catalyst that you need to find. And I saw in the best clinicians that I've worked with in Kieser Australia, and I'm saying exercise clinicians as well as physiotherapists, in the best trainers that I've seen at Discover Strength, that part of their magic is being able to understand why someone does this. Yeah, they're really good practitioners and they can deliver a really good workout, but they understand they help that person understand why.
Right. Yeah, I love that. So ask why 5 times. Yeah, because the first time you ask it might be like, oh, I just want to, get stronger, or I just want more energy. And then after 5 times, you realize that, their uncle has had a serious fall and has broken their hip and is now like immobilized and in hospital. And you're like, oh, okay, so that's the fear that's actually driving this. But you got to ask
Yeah.
those questions. You got to, like you say, be creative and ask why in a different way. I would say like 3 to 5 times to probably get there. I've certainly experienced that multiple times. Yeah.
Yes. Yep. Yeah, it's a rule of 5. Like you have to ask 5 why.
Okay.
You have to ask why 5 times and not tongue tie yourself when you do it. But I mean, I've heard stories like, people say, oh, I want to get stronger. And it actually comes down to, I was on the floor with my nephew the other day, and I hopped up and it was hard, and I felt old, and I don't want to feel old. So strength in and of itself is a bit arbitrary. Like it needs to be attached.
It's too abstract, right?
Something. It's too abstract.
Yeah. That's so interesting.
And this is a change for us in our industry. Like when, this industry was born out of aesthetics and like strongman competitions and bodybuilding. And that's not what it's about anymore. Like if we want to, every fitness industry that I speak to, and the reason they asked me to come and have a chat to them is that the fitness industry wants recognition as health. Australia, the US, the UK, they've been through COVID and they're like, we're essential. We want to be considered health so that next time COVID happens, we can stay open because we're really important. Well, if that's the case, you need to start to talk to people about their health and find out why it is that they're actually coming in.
Yeah, so true. Let's talk more about that in terms of building that trust. Like, we spoke obviously a few years ago. What was it 20? I can't even remember. 2020? No, that would have been obviously COVID. I think it was 2019.
I think it was
2019?
No, it was 2021. It was after COVID.
Yeah, you're right.
Because my first trip got cancelled because,
yes,
unfortunately, I got COVID.
So yes, you're absolutely right. So we spoke then, and you obviously explained, and I'll suggest to listeners, actually, we'll put a link in the description to this, a link to our first podcast, which is incredible, thanks to you. And obviously that was live at Rec in front of a crowd. So I was really nervous. So you probably get entertained by that part of it. And, you were speaking then about, how there's this big, the theme of the discussion was, how do we build more trust with the medical professionals so that we get more customers and we can help more people, right? Ultimately. How do you think, maybe, I suppose you'd be probably more keyed into how that's changed in Australia more than anywhere else. Have you seen that improve since 2021? Have you seen that in commensurate? Obviously commensurate with the rise in awareness of how valuable strength training is for health. I assume that kind of correlates quite nicely with the number of referrals you got from doctors and medical professionals. However, I'm not taken away from the amazing job that Kieser Training did and that you did with building those relationships up, because I know there was a whole strategy around that. I'd love to ask you about that one day. Although actually you do share a lot of the insights on that in our previous episode, so thank you for that. So where was I going with that? How much have you seen that change, if at all, in terms of the trust? Or is there still a problem there? Is there still an issue where the medical establishment are like, no, personal trainers have no idea what they're doing, they're just hurting everyone? What's the zeitgeist in terms of that right now in Australia, at least?
Well, I think it's progressed. So what's happened is the awareness of the benefits of strength training has gone up significantly, like through the roof.
Yeah.
The nervousness around people getting injured, I think probably remains about the same, but there's more and more evidence or experience amongst those practitioners that they can send people for exercise and they don't get injured or they don't have an adverse event. So I think from a research perspective, one of the things that we should highlight, see, when you write a research article, there's often like one line in there that says, 2 people had adverse events and couldn't complete the intervention, right? And often it's lower, often like one person.
Mm-hmm.
And I think that the value of that has been lost on a lot of people. So we did a research study with Swinburne Uni, and we looked at people post midline sternotomy. So where they will literally put a angle grinder through your sternum, open you up, and give you open heart surgery, right? And in the past, the recommendations for exercise after that were, and forgive me if I'm slightly wrong on the details of this, were don't lift more than 2 kilos for 12 weeks. Differed slightly surgeon to surgeon. And based on our clinical experience and what we knew, and full credit to Professor Doa Al-Ansari and Jackie Pengelly, who led this study, and I was just support. But we were adamant that people could start strength training earlier. So we put an ultrasound wand on their sternum, still with K-wires fixing their sternum together. So we took people who still had K-wires in their sternum after surgery. We put an ultrasound wand on them to measure how much movement there was in the fracture line, and we showed that there was no movement. So instead of saying to people, hey, you can't exercise for 6 weeks or 12 weeks after this midline sternotomy, we had them strength training inside of 10 days.
Oh, wow.
After heart bypass. And we published that first study that with the ultrasound to say, hey, this is safe. And then we took people through a protocol of it. And we had 2 groups in that protocol. One was an early exercise and one was a conventional exercise. So they did really, really, little movements. They did some movements, but they didn't do much strength training. The addition of strength training in that cardiac surgery cohort showed that they got back their normal cognition much quicker than the people who weren't doing the strength training. So one of the risks after a general anesthetic and after cardiac disease is that you show cognitive deficits, and you can show cognitive deficits for months and months afterwards. The addition of early strength training got all those people back to baseline within 14 weeks. And my point there is that in some areas, we've started to show just how safe exercise is. So where did the perception come from that strength training and exercise wasn't safe? In my honest opinion, I think it was deserved. I think that because we went from, training people purely for performance and prosthetics and bodybuilding, all that stuff, that probably there were a few people who were injured. And unfortunately, as safe as high intensity training methods are, you still get tainted with the same brush as everybody else implementing strength training.
Yeah.
And so the awareness of the benefits of strength training have gone up, but also the recognition that strength training is actually quite safe. Like that's gone up as well. And one of the things I would have referenced in that podcast that we did at REC was that if I'm a doctor and I'm going to refer someone for exercise, I'm putting my reputation on the line. Like I'm referring them to you. Like that's my reputation that you now get control over. So as practitioners, I mean, we can talk about this at a later date, but if I'm a practitioner and I want to build a relationship with a doctor of any sorts, one of the first things I'm doing is I'm saying my exercise is really safe.
Mm-hmm.
That as a starting point. So I might be talking about that before I'm talking about it being really effective. And that's kind of flipping things on a head for most people, because most people would go in and go, hey, Lawrence, I can improve strength by 30%, and I'm going to drop blood pressure by 6 points, and, start talking about the benefits. Well, they probably already know the benefits. Possibly in some places, the barrier is actually for both referrers and for clients. The barrier is potentially safety.
So, such a good point. And that your messaging should be so heavily anchored around safety. Paddy Durrell over at Rock Solid Fitness in Florida do a great job at this, by the way, in terms of the letters they send to doctors. I know you guys, mate, you've got a tremendous amount of experience in this as well, Tim. So I think we'll probably park the how-to guide on that, because I do want to do a separate episode on that with you at some point. But no, that totally makes sense, right? To focus on safety if that's what the concern is. So just a couple of things on what you said, which I didn't fully understand, is you mentioned that, there would be a study and they would have, 1 or 2 participants who couldn't complete the program for whatever reason.
Yes.
What was the significance of that? I didn't understand that.
Sorry. What I was saying is that was kind of in a lot of studies in the past, I think that received only a little bit of attention and a little bit of focus. Whereas I think that's a wonderful thing. Like if you next time you read a strength training article, find that bit, like it'll be in the results somewhere. They have to include it somewhere in their result. I think that deserves a paragraph, because I think it's such a barrier to clients starting and medical practitioners referring. I think as researchers, we were giving it a line so that we could tick a box from a safety and compliance perspective. I think that we should give it a paragraph or 2 to really reinforce that you can have really severe lower back pain, and with the right guidance and the right practitioner, exercise is safe. You can have, there was times where, any increase in blood pressure and people, say any hypertension at all, and people would be really worried about participating in exercise. Now we understand that, there's a transient increase in blood pressure during an exercise session, but the relative risk is outweighed by the benefits. So it's important for us as practitioners to know what our limits are. Like, working with really sick patients is slightly different for me as a physiotherapist compared to someone who doesn't have the physiology and the pathology background that I've got. But, exercise is really safe. And my point about the research was that I think it's how safe it is has started to receive a little bit more attention. And therefore we've been able to convince a few more doctors and convince the medical profession that, hey, this is a good idea to send your patients for it, because not only is it good for them, but they're unlikely to go backwards as well.
Yeah. So I agree with everything you said, but what I still don't quite understand is, surely, maybe I misunderstood this completely, but it's like those 1 or 2 individuals that couldn't complete the study, is that not because they were like contraindicated in a certain way? There was risks or whatever. I thought that it would have the opposite effect. It would scare people because they look at those small details and blow them out of proportion. Have I misunderstood that?
I'm sorry. I get your question. Well, if it's 1 or 2 out of 1,000, then the point that the rate of adverse effects is really low.
I see now. Yeah.
Let's compare it to pharmacology, right? The rate of side effects in pharmacology.
Right.
The rate was 1 or 2%. Pharmacology would be a lot safer.
You know what though, Tim? The media will still blow that up. That absolute risk versus relative risk, isn't it? Because they'll blow out of proportion those 1 or 2 who had adverse effects.
So that's on us. I honestly think that's on us, Lawrence, and it's why I've continued to maintain a little bit of a presence in media as much as I can, because I could then go to, when we did this study, I could go to the media and say, hey, look, did you know that 6 days after you've had open heart surgery, under the right supervision, you can safely exercise? And they were like, wow, this is like, we did a segment on morning TV in Australia that says, with a patient in front of camera. And he says, I just couldn't believe that my surgeon recommended, and it was safe for me to be able to do this. Mm-hmm. By the way, I'm definitely not recommending that, every high intensity practitioner out there do that, but it's just an example of read the research article and you'll be surprised about how many people strength
Yeah.
training is.
I do like that, your attitude towards that. It's like you took ownership of that. You were like, well, look, yeah, that maybe that happens, but that's on us then to actually maybe do more PR, more involvement with the media to explain the benefits of what we do. I'm curious why you actually said that you don't necessarily recommend our colleagues do that, because it's great marketing.
I think there are high risk patient groups, people at 6 days after midline sternotomy. That is a very, very big surgery. I would be saying those people need to be seen, and so they were supervised
Oh,
by
I
a
see.
psychologist in this
Right.
case. But the idea of we need to look internally first. You will appreciate this name, Sterling Morlock, former captain of the Wallabies rugby team, gave me this phrase
I
once
wish I had known that. Yeah. Sorry, go on. Not a rugby man. Go on.
Um, always, always there's two types of people who look in the mirror and people who point through windows. And I think, you know, we have about 10% of people in our countries who are compliant with our strength training guidelines of training twice a week. It is incredibly low. It's about 10%. Now, we can point through the window and say it's their fault and they should do more. Or we can look in the mirror and say, well, what can we do differently to what we've done before to engage a different population? So I'll give an example. I think one of the smartest things Werner Kieser did when he started, so his first Kieser studio, he opened in 1967. And of all the Kieser studios around the world, none of them have a mirror.
Mm.
And that isn't like a science, this isn't a science debate about should he have done 1 set or should he have done 3 sets. But by taking the mirror out of a strength training studio, he took away a lot of intimidation for people. And he probably in 1967 wasn't thinking, oh, gee, the world's population is going to be aging and 56% of people are going to have a chronic disease and 66% of people are going to be overweight. And the last thing that they want to see is themselves in the mirror. But as it turned out, that is one of the really intelligent decisions that he made that has opened up strength training to such a wider variety of people. And I've participated in your conversations on school, and I think they're a great place to have a chat. And one of the points that I always say to people is that this game is a mix between science and art. So, let's assume for a second that going to momentary muscular failure, it gives you 100% potential benefits in 1 set. Right? Let's assume going 2 reps in reserve gives you 80% of the gains. But that going 2 reps in reserve is a little bit more comfortable. And so people are more likely to train longer term because it's more comfortable for them. Well, in some situations, yeah, I always want people to train harder, but I'm very happy to meet people
100%.
where they're
Yeah.
if it results in the training for the longer term. And yeah, we got to get this balance right between art and science, because is the game to have everyone train perfectly? In my opinion, no. That's not what I'm here for. I tell you that. That's not what I'm here for. If someone else is here for it, good luck to them. They should use high intensity training protocols. But if the game is to help the health of a population, then we need to think about participation. And getting back to what we spoke about at the start, we're so fortunate that the more people who participate in our business, the healthier the world is. So the more successful our business is commercially, in most senses, then the better it is for the health of the economy. And the spending of, like the US, this stat before, that the US spends 90% of its healthcare on chronic disease and mental health. That is,
Wow.
that is,
Wow.
it is a mind-blowing number. So I do really think about, I always have a bias of participation. And, that was one of the reasons why, why we were able to grow the business to a large group of people, while we had 20,000 members by the time I left. And I do think sometimes it's a limiting factor in the growth of some businesses, is that participation in exercise is more important than perfection. And I think that if you take a little bit of a step back as a business owner and you ask yourself that question, okay, where can I facilitate a bit of participation? Now, we didn't let people train sloppy, and we didn't let people train, really half-hearted. Like, there was areas that we weren't willing to compromise, and I wouldn't recommend anyone compromises. But yeah, thinking about how you get more people to participate is a really good question.
Yeah. Except for the changing rooms, right? Mirrors in the changing rooms, because that was important for me, Tim, when I used to flex after my session. Anyway, so is that stat you said there, 10% compliance in, is that Australia in terms of strength resistance training? 10% of people?
It's pretty much worldwide. So I've had
I
this chat.
thought that's an improvement. I thought it was single digit before.
Well,
still low, but
it depends. If you cut it, you're probably right. I'm probably being a little bit generous, probably rounding up to 10. It does depend on the age cohorts. Depends on two things: the age cohort that you use, and also what you define as muscle strengthening activities.
Got it.
So it's definitely not 10% of people do strength training at a gym, but approximately 10% of people in Australia participate in muscle strengthening activities.
Got it. Okay. No, I agree very much with much of what you said and the sentiment of what you're saying. I for those that have been a long time listeners of this podcast, when I first started out, I was extremely dogmatic about high intensity training to failure being like the only way. And over time I've softened, and I'm now of the similar view to you, where it's like, as long as people are lifting weights in some way, the evidence is quite clear that, even at kind of like moderate intensity, people are still getting significant benefit, right? And like you said, the focus should be on how do we get people started safely, and how do we just try and improve them over time and keep them compliant and progress them over time. Because like you said, if someone starts and they're going nowhere near failure, they're still getting a benefit. And then if you can get them 1% closer to muscle failure, or 1% increase in intensity, like once a month or whatever, then like that's great progress.
Yeah, I agree. I think there's a couple of interesting things. One, particularly from a high intensity training, like from our community, when we think someone's training, at a moderate intensity, I think a lot of other researchers would call that very, very, very high intensity.
Right. Yeah.
I think, we need to recognize kind of the place that we've been in, the people who we chat to, the expectations that we set, the expectations we set for ourselves. And, our training protocols are very high intensity. And so you should be really happy. If someone's got 2 or 3 reps in reserve, that's still very, very high intensity. The other thing is, whatever training principles you want to argue over, whether it's machines or free weights, 1 set or 3 sets, fast or slow, whatever principle you want to argue over, nothing ever beats the longevity of your program. So if you want to, predict outcomes, the predictor of outcomes is how long do you do the program for? How many times in a year do you do it twice a week? So this is why you can, in some respects, you can go and get 2 bricks outside and, do exercises with bricks. If you're consistent to that program, and that's the most consistent that you can be, that will dictate your outcomes. And that doesn't mean that nobody needs to join a gym. very, very strong against that, because the influence we can have on individuals by making them physically safe, by being empathetic and making them feel psychologically safe, by giving them a bit of accountability, by motivating them because you're charismatic and funny and good looking, and these are all compliments to you, Lawrence.
Thank you.
The impacts that you can have on people is significant. Like, we know in the physiotherapy industry, if we give people home exercises to do, their compliance rate is single digits.
Really?
Wow. Yeah. If we supervise them, the compliance rates go through the roof. Which group do you reckon gets a better outcome when we're trying to treat their back? It's really simple. So,
can I just I just want to underscore that, because that's so important. Because I think maybe a lot of our colleagues might try and offer some kind of like, oh, well, if you can't afford or can't, justify twice a week, then here's a home program to do on your other session. Do you know what? I always used to use that as my like tactic to increase training frequency of clients. I would say, yeah, I could do this for you. You won't do it though. And we'd have a laugh, and I'd say, look, if you really want these outcomes, if you really want this result, then invest in yourself. Because like like you're saying, the evidence, I'm assuming, do we have data? I guess we do probably, that, that adherence to exercise is just really low, right? If you're prescribed a program versus being accountable to a trainer of some kind, right? We have, don't we? Yeah, go ahead.
Yeah. And I think James Fisher's research shows that compliance.
Yeah, I should know that. Yeah.
Add supervision to it, that people have compliance.
Yeah.
And I think so that discussion, it's a really good point. Like, cause everybody listening to this has been in that discussion around, it's the sales point of, how do you sell this? Yeah. I think when you're, the type of clients that we're talking about now are slightly different, because we're talking in the chronic disease space. I would often ask questions to them, and by the time they come into you, a lot of them, not all of them, tend to have pretty good self-awareness by that point. So Lawrence, if, I can give you a program to do at home, or you can come in here twice a week and do the program. Which one are you more likely to do? Because whichever one you're more likely to do is the one that's going to give you better results. So over a year, how many times are you going to do that at home? And how many times are you going to do that with me? And, for most people, they see that, and they really, at that point in time, they want to adhere to the program. They want to help themselves. So they will commit to the thing that gives them the best chance. Yeah.
Yeah, I completely agree. And I don't know why I said that earlier. Of course, I was aware of the supervision research from James. I've had him on the show talking about it more than once. So I just had a brain fart there. So no, obviously that's well understood in our space, and it's something that we should be leaning on more when educating our clients on how they can get the best results over the long term. You've had workouts with Discover Strength, right? When you've gone over there and stuff. Yeah.
Yeah. I'm curious. I love it when we get Discover Strength.
Oh, don't we all? I miss them greatly. I'm really curious to hear like your experience. Like, how does the intensity, because DS is particularly high intensity. Like man, like I thought I was training hard, going to failure, like with my own workouts, but their trainers are just so good at taking you to that next level. How does the intensity of those workouts compare to what you were doing back in Australia?
Significantly higher.
Really? Even though you would train to failure, I assume, like, but not beyond perhaps? Like, how would they compare in more detail? Yeah.
Okay. So in Australia, I would train by myself quite a bit. And I would train sometimes under supervision. And I'm comfortable saying that I think I understand the benefits of strength training as well as more than most people. And you know what I did when I trained by myself, Lawrence?
What'd you do?
I cheated. I cheated on the movement. I convinced myself I was definitely done. Like there's no way I could have done another repetition. And so this is my story between, so then I started training with supervision and I understand how important intensity is, and I train. Honestly, I don't train 5% better with supervision. Mine's probably like 20%.
Wow.
And I reckon when I went over to DS and trained with David, or if I trained with Taylor, and full credit to both Taylor and David, like it's probably another 25% on top.
Wow.
And,
Amazing.
and so here's a bombshell for you, Lawrence. I don't know if I've ever said this to you before. I don't like strength training. Don't like it. Don't enjoy
I
it.
hear you. Heard.
I live in Sydney in Australia. I love being inside. I'd love to go for a surf. I'd love to go for a run. Luke Carlson is a very, very good friend of mine. Luke loves strength training. Like he loves doing chin-ups. He loves doing leg extensions. I don't. I just know the benefits of it. And so I love in a supervised session that my supervised sessions would be 20 minutes. That's it. I can, under supervision, I can train really hard, 20, maybe 25 tops. Very rarely 25 minutes, though. 20 minutes, I get 10 exercises done and I'm done.
Yeah, like Luke's an absolute masochist. And I think his workouts actually, I don't know if this is still the case because I know he's extremely busy these days, but his workouts will go to like 45 minutes just because he'll want to do like 15 exercises or something. It's insane.
Yeah,
Yeah.
might have something to do with how many bicep curls he's doing. And
Yeah. He'll definitely listen to this and enjoy this segment.
yeah, I can't wait to get a text on.
Yeah.
But I do think that maybe my own perspective on not actually loving the process has been a really beneficial thing for me, because I didn't, probably less than some other people, I didn't get caught up in loving the high intensity and being focused on that. I was more like, okay, well, I need to get this done. I see the benefits of it.
Yeah.
I can probably to a little bit more of an extent, put myself in the shoes of the clients. And that's what I would kind of encourage your listeners to do. And this applies to whether we're talking about chronic disease or we're talking about referrals from doctors, or we're talking about almost any aspect of owning a strength training business, is know exactly who your clients are and put yourselves in their shoes. And if you can't put yourself in their shoes, go and buy them a coffee and ask them 5 or 10 questions about their perception of strength training. Because, I'll go to conferences of the fitness industry, and most people at fitness industry conferences are strong, of normal weight, and compliant with the government's physical activity guidelines. And so they just do not represent, the average population. It is a biased sample. So you've got to take yourself out of your own world a little bit and put yourself into the clients. And that's, it doesn't matter what industry we're talking about. That's how you make a successful business. Like I was coaching a guy today, who owns a business called Sydney Harbour Surf Club, and they take out kayaks on Sydney Harbour, most beautiful place in the world, to go for a kayak paddle. And he's an incredible paddler. Like I go paddling with him, can't keep up with him. And I said, his name is Luke as well. I said, Luke, like you've got to put yourself in the shoes of your clients. And, we had a few epiphanies today, because he's like, oh, I've been doing it this way, but I think the clients are actually coming for that reason. So yeah, put yourself in the shoes of clients. And if you think you've done it, try a little bit harder, go again. I think it's a really estimated, simple business strategy.
Yeah, thank you. In the words of Pete Sarquhar, it's not about you, it's about them. So it's the same message. And just for context, because I always forget to do this because there'll be like new people listening. Luke Carlson, who we keep mentioning, is the owner of Discover Strength, and him and his team used to operate the Resistance Exercise Conference where Tim and I first met, and that is now called the Strength Forum, which is a smaller, more intimate, but awesome gathering happening in Orlando in November this year. If you're interested in that, you can communicate with me on the Score platform. Just join score.com/HIB-free. There'll be a link on here as well. Tim's in there giving great advice, which I really appreciate. And David Schneider, who Tim mentioned, is also part of Discover Strength. Do you know what I'm seeing, Tim? Something that I wanted to talk to you about briefly, which is a little bit unrelated to chronic disease, is I'm connecting with a lot more people in Australia about high intensity training who are like opening businesses, or they are, and it's quite a blend. It's like guys that are operating with like adaptive resistance technology, more the kind of biohacking feel. You've got guys working out of like big box facilities who are using a HIIT method in their training, like brief, intense sessions. Yeah, so I'm seeing like a lot more interest, and I'm wondering if there's like a halo effect, like if in part it's because like Kieser training maybe had an influence on this because you guys scaled so rapidly, just to such a large size in Australia that must have actually probably inspired quite a lot of people to do their own thing. Pat, I don't know if that's I'm theorizing, but have you seen
Lawrence,
it? Yeah.
no. Like the surprised look on my face is
Oh, I
I haven't.
see. I see.
So I'm really interested to know who these people are, and if they want to reach out. I'd love to have a chat. If they're in Sydney,
Oh,
I'll
yeah.
buy them a coffee. I'd say back if they're in Sydney, I'd love to come and do a workout with them, because my experience is still there are very few people who know much about high intensity training. There are very few people who know much about Arthur Jones and his training principles, and it always surprises me, because I think about exercise from a population level and not from a pure performance level. I honestly, I don't understand why 2/3 of strength training programs in this country aren't single set, high intensity, 10 exercises and done. I can see why, some people just love the volume and that's fine. But I just don't understand it. I just don't get it. If I had my way, that would be an influence that I would have over the fitness industry in the next 10 years, is that more
Yeah.
people would. I think that's great. So yeah, I would love to meet those guys and girls from Australia.
Cool. Yeah, let's. I really want to just expand on what you just said there. Let's put a pin in that for a moment. Yeah, just to be really clear though, it's still like a tiny number, like relatively speaking. Now, obviously, because we're in such a niche, I obviously attract people, from our space, and it's still like, when I say, oh, there's a proliferation of high intensity training in Australia, it's like 10 people, So,
Well, it's an infinite, like an infinite increase on before, because previously it was Kieser. I was aware of about 5 MedX facilities.
Okay. Yeah.
In Australia.
Yeah.
That was it. So
Yeah.
10 is, especially if they're coming from all different places, a pretty significant increase.
Yeah. Yeah, absolutely. I'm very happy to connect to you after this, and I think they'll be thrilled to connect with someone like you, Tim. So that's super exciting. And I love what you just said there, and we'll probably just wrap it up after this, but your point there about, why are 2/3 of the country focused on kind of traditional weight training approach, like 3 sets of 10 or whatever, 4 or 5 times a week, and throwing in all sorts of other modalities probably as well, right? And you said you didn't know, and that's fascinating to me because I feel like you do probably know a little bit. I've certainly got my opinion, but yeah, I guess I'm just going to ask you a follow up to that. Like, why, if you had to guess, because you said you don't know, but if you had to guess why you don't think it's moved on, why you don't think more of these practitioners aren't embracing this more kind of innovative method to helping people, what would that be?
Okay, so if I clarify my response and say I do have opinions on why they don't, but I'm not sure why they haven't moved on. Right. So I understand that we have come from this, bodybuilding, typically multi-set, sports performance, typically multi-set model. I also understand that the human brain always in exercise and in so many other things assumes that more is better. Like it's counterintuitive that less sets or less exercises, might be better. I also think that high intensity training is uncomfortable.
Right.
To really get the benefits out of a single set, I think you need to approach failure. And the closer you get to failure, the more uncomfortable it is. And so you could probably get some benefits out of volume that are a little bit less uncomfortable. But, like the discussion I have with people is really simple when we talk about, let's talk single set versus multi-set, right? I say, okay, so 3 sets of exercise, assuming you have a break in between. Let's say for a second, Lawrence, that multi-sets is better than 1 set. Let's just assume that it is. It takes not 300% of the time, it takes 400% of the time because you need a gap in between. So 400% more time. How much better does it have to be to justify it? So it's really clear. Nobody could argue that you're getting 100% more benefits from doing multiple sets, right? Nobody's arguing that. No one in the world. No one in the world is arguing that you get 50% more benefits. There are still arguments going on about what that number is. Is it 0%? Is it 10%? But what you can't change is that it's 400% more time. And the number one reason that people don't participate in exercise in this country under 45 is time. Over 45, I mentioned before, is injury or illness, but under 45 is time. So in my mind, I'm like, well, it's 400% less time. Why haven't more people taken it? And I think it is.
Oh, you mean more, you're talking more about the side of why aren't more people doing this type of training?
Why aren't more people doing single set? Because it's going to save them so much time.
Sure.
Like if time is the biggest issue, the biggest fitness companies in this country are Anytime Fitness and F45. Like time is so important to those businesses. They've put them in their name and that's why they've grown so much. So in my mind, I'm like, why doesn't the training protocol that saves you so much time, why hasn't it been more successful? And I don't know what the answer to that is, because in my mind, I would have thought that we would have learned some lessons, realized that there's huge efficiency in single set high intensity training, and it would have grown.
Yeah. Interesting. Makes you think of like there's a good idea then to where you can incorporate time in the company name. I know my friend Steve, his business name is Time Saver Strength, right? And obviously, I think a lot of our colleagues will have strength in the name, which I think is a good idea. Discover strength, which we've spoken about. I'm thinking strength in less time. That could work quite well. I don't know. You just got me thinking now about incorporating the word time more in our messaging and our company names, things like that.
Yeah. Well, okay. So if you had a choice between, like if you're talking about advertising, marketing, and branding, if you had a choice between and you were consumer facing, so this doesn't apply to high intensity business, but if you were consumer facing and you had a choice between using the word intensity or time, or a message of like high intensity or time efficiency, I think the branding decision you would make would be a time efficiency one. I don't think many people, I don't think the large volume of people are choosing places because of intensity. I think they choose it because of time efficiency. It just comes back to, and maybe this is a good point to kind of bookend the conversation. One of the first thing I said tonight was understand your clients, like really deeply understand your clients. And, I think that's my same message on time and intensity at the end as well is, ask your clients, why do they choose to come to your studio? Why have they stayed at your studio? And the answers that they give you are the ones that you want to double down on and reproduce, because they're the people that you've solved a problem for. and there'll be lots more of those out there.
Awesome. Thank you for that. That was a great way to sort of like start to wrap this one up. Tim, really appreciate your time. There's so much more to talk about, and we'd love to have you back to get into some other topics. If you want to connect with Tim, you can find Tim on LinkedIn. It's Tim Dettmann, 2 T's and 2 N's. So TIMDETTMANN for November. Apparently people get that wrong sometimes, eh, Tim?
Yeah, the double confuses a few people for sure.
Yeah. And we'll have links below in the show notes for this as well. And then you can go to Tim's website, timdettmann.com.au, for more information about speaking and consulting that Tim does as well. And again, just want to mention, if you're interested in some help to start and grow your strength training business, come and join us in the free community on Score. That's score.com/HIB-free. There'll be a link below. When you get access to a great community of professionals, free playbooks, courses, and resources, and the occasional call and Q&A as well. Tim, thank you so much. Really appreciate your time. I could not function as well as you have at the hour that it is right now in Sydney. So I appreciate you doing it.
Lawrence, thank you so much for the invite, and behalf of myself and everyone else in the industry, thank you for what you do. Like, not only do you impact the life of, business people and help them grow their businesses and the impact that can have on their family, but I think there's a cumulative effect of all the clients out there that you help as well. And 100%. I really, really do believe that even us, we underestimate the benefit to happiness and longevity of exercise. And so your impact right across the world must just be huge these days as a result of this and of school and everything that you do. So thank you on behalf of everyone.
Thank you, Tim. Appreciate it. And for everyone else, it's Lawrence with High Intensity Business. Thank you for listening, and we'll talk to you very soon.